Dr. Vivek Vij. I am Chairman and Director Liver Transplant and GI Surgery at Fortis Hospitals. So today I am going to share 5 tips after liver transplantation which will improve your quality of life and prevent the complications. First tip is to be in contact with your liver transplant team regularly and especially in emergencies. You have to be in touch with your liver transplant team for any problem which you suspect or just for a regular checkup. Because if you go for a regular checkup, your underlying liver condition can be judged, can be investigated at a very early stage if there is any problem, and it can be treated easily. The second most important tip is to stick to your medication. These are immunosuppressive medication which are of very paramount importance after liver transplantation. Now these medications help the immune system of your body to interact with your new liver and maintain its healthy state. Now consider a situation when you don't take your medication. Of course, your own immunity can damage your new liver. So it's important to stick to the schedule of the medication you are taking. Third tip which I am going to share with you is about your diet. Diet is very important after liver transplantation. Generally speaking, there are certain guidelines about diet to maintain a healthy lifestyle, even in normal subjects. After liver transplantation, this becomes very important, because a candidate who has undergone liver transplantation, a patient who has undergone liver transplantation, tends to gain weight with time. Now when the patient gains weight, he lands into a situation called as metabolic syndrome, which is diabetes, hypertension, obesity and other syndromes. Now this patient who gains weight is more likely to suffer from coronary artery disease or cerebrovascular accident later on. So it's very important to maintain a good diet after transplantation. In a good diet, you should avoid sugars, you should avoid fatty meal, you should take lots of antioxidants and nuts and try to maintain your body weight. So these are general tips about diet after liver transplantation. The fourth thing I'm going to talk about is exercise. Exercise is very important for us, all of us, especially after liver transplantation. I personally recommend 30 to 45 minutes of a brisk walk or any aerobic exercise after transplantation in a day, at least 5 times in a week. That will help reduce the fat in your liver, that will help maintain your body weight, and that will help in increasing your physiological capacity. The fifth most important tip to prevent complications after transplant is to maintain your hygiene. Hygiene is important because a post-transplant patient is more likely to get infections from the surroundings. When I talk of hygiene on the personal level and at the society level. Now you have to maintain your personal hygiene, which is very important, because the bacteria which are residing in our body can also infect you. So if you maintain a proper personal hygiene, chances of infections are less. Second most important aspect of maintaining the hygiene is to prevent a situation where you can get infections from your surroundings. That is, suppose there is a social gathering, you go out, you have to maintain a distance from the person. You have to create a situation where you are less likely to get infections from your surroundings. Try avoiding going to a crowded place. Try avoiding going from a public transport if you can. And third thing is, of course, when you go out, you tend to eat from outside. Now GI infections or gastrointestinal infections are very common after transplantation. I would always recommend don't eat from outside. If you are hungry, please carry your food along with you. You can eat fruits. There are a lot of options. Take fruits, nuts, carry your own food to prevent any infection from the surroundings.